On Monday, 13th July 2020, 58 passengers had landed to Fomotu International Airport since Tonga had closed its border.
Tahatolo monite o siulai wanoa. Ko tuuta ke mala vakapuna Fomotu, ai fofua kau pasese e toko ni mavalu, ko folau mai ki tongani talu no tapuni o tau kau afonua.
They are being quarantined in the Tanoa Hotel in Nuku'alofa.
O whakahako na kolontini ki nautolu I hotele Tanoa I loto Nuku'alofa.
It is clear that the deadly virus may enter the country, and therefore these information are shared here in the spirit of helping one another.
Og mahino ay malawa ke humahen ay vailas whakaauha, pe aglota ay proklaman ke wahwahe at hangay whakamatala, ihalau mario ifitokon.
These are the daily day-to-day symptoms of COVID-19.
Kung ay whakailonga whakaaho en ealaha me hataha, kunin mau ay whakautua COVID tahiva.
These may vary from person to person.
Kung ay whakailonga og malawa ke pekit ko tahakutoa.
But according to a multitude of surveys conducted on COVID-19 patients all around the world, majority of patients share these symptoms.
Sa whatatau ke ngai sabi alahi ko os whakahako takatakay imamani. Kutoko lahi taha, netang mau ay ngai whakailonga ko eni.
Day 1 to day 2. The beginning symptoms are similar to the common cold, with a mild sore throat.
Koe aha uraki moeua I hono mau koe vailasi. Uwofi apito hono whakailonga I ngai whakailonga o momoko, pe ako kaukai mo mamahi o monga.
Patients can still consume food and drink as usual.
Okay, malawa lelebe at ko tahan o kai moin o hangi ko yang mahini.
Day 3. The patient's throat starts to feel a bit painful.
Koe aha hono tolu. O kamata kayo ngoi ito ko tahan ay mamahi ahono kia.
Body temperature reads at around 36.5 degrees Celsius.
Malawa ke kaka ene fua mafana ke degrees Celsius e tolu 1.5.
Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in.
Nengo okikai ko yang mahini, malawa ke hoko hakini ni moheni ya mwe whakalere.
Day 4.
Aho hono wha.
Throat pain becomes more serious.
O au ke te whakalalahi ang mamahi o monga.
Other symptoms like feeling weak and joint pain start to manifest.
Malawa ke asmo yung itabay-bay ang mwelanga ang hokotanga hui.
The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius.
Ite malawa foki kaya ufo mafana ke degrees Celsius e tolfit.
Day 5 to 6. Mild fever starts.
Aho nima ke aho nono. Kamata ki mofi.
The patient show a temperature reading above 37.2 degrees Celsius.
Malawa kaya ufo mafana ke degrees Celsius e tolfit tolu.
Dry cough also appears.
E kamata ke asma ya tare pakpak.
Breathing difficulty may occur occasionally.
Betay mini. Kamata ke whainga taa e mana ba.
Most patients in this stage are easily feeling tired.
Ito nga ko ni, o ko ngoi e to tapuke, o hela ia vave.
These 4 symptoms are among the top 5 key indications of COVID-19.
Ningo e malaba ke ai mamai whailonga ke. Kako to lahi taha na nau mau e ngai whailonga ko na.
Day 7.
Aho hono fitu.
The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty.
Kapa ute ke foke to tapuke o sai, e malaba ko te alu ene tare o whakalalahi au pitu. Kai pehe ke whainga taa ia ene mana wa.
Fever can get higher up to 38 degrees Celsius.
E malawa ene mofi ke te kakahaka wa ke fua mafana e tolval degrees Celsius.
Patients may develop further headache and body pain, or worsening diarrhea if there's any.
E malawa ke whakalalahi alanga ulupe me whilanga o sino. Pero pau ne kamata whakalere ki mua, pe te whakalalahi me whakalere.
Many patients are admitted to hospital at this stage.
Ko toko lahi taha, utok awi kina utok whalemaki I tunga ko ni.
Day 8 to 9.
Aho hono walu ki aho no hiva.
The symptoms are likely to be worsened for the patient who has coexisting medical conditions.
E malo ke te kowe nga ngai whakailonga ke ni, ukurotonga iai ko nau ngai whakautua kehe.
Severe shortness of breath becomes more frequent.
O whakaau ke whakalalahi mo hoko no no o e mana wa.
Temperature reading goes well above 38 degrees.
E malawa ke au e fua mawhana ke degrees Celsius e tolu hiva.
Day 10 to 11.
Aho hongo fulu ki tahataha.
Doctors are ordering imaging tests like chest x-ray to capture the severity of respiratory distress in patients.
Kukamata ke whakahako e kautukata a ngai whakaata. Ke wakai I palopalema I halanga mana wa.
Patients are having loss of appetite
Kamata ke more e uakai.
and may be facing abdominal pain.
Pea e iai ni e hoko pe melanga o ikete.
The condition also needs immediate treatment in ICU.
E malawa ke ia menga whaelonga ke, aia e ala fia maa kono whaito whakawawau.
Day 12 to 14.
Aho tahaua ki ta wha.
For the survivors, the symptoms can be well managed at this point.
Pen ihi koia e moui, ko kamata ke na wongo fia maari e.
Fever tends to get better, and breathing difficulties may start to cease on day 13.
Kamata ke holo ai mofi, pe kai te whaingata ia e manawa e ahono tahatolu.
But some patients may still be affected by mild cough, even after hospital discharge.
E ai han ihi te nau kei tarepe, neongo hono whakatag na tonu me whalemahaki.
Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients.
Aho tahanima, ko whihanga ngā ia uni ihi ko ata me whalemahaki. Aya ko ki toko si en ko siala e whakoutua.
The fragile group must prepare for the possibility of acute cardiac injury or kidney injury.
O malawa ke si hanga tenu ihi ko ni, ke ngai palpale ma whelawe ki he mafu, pe koe ko fua.
Day 17 to 19.
Aho taha fitu ke taha hiva.
COVID-19 fatality cases happen at around day 18.
O whaaho koe mate e aho no taha walu.
Day 20 to 22.
Aho wanoa ki he ua.
The surviving patients are recovered completely from the disease and are discharged from the hospital.
Koe ni ihi koe ko kamata ke nausai, ko nausai au pito pia me he whakoutua.
As mentioned earlier, the day-to-day symptoms may vary between patients.
Hange koe ne lawe kai ihi kamata, umalawa ke he pea ngai whakailonga, ihi toko taha taha.
While we may have our Tongan herbs and traditional healing techniques,
Neongo ko sepe tau ngahi lau i akau me whunga whakaito whakatonga.
and while we may also have spiritual healers,
Pea neongo ka pau kiai mo hakau whaito whakalotu.
it is vital that you contact our Ministry of Health to avoid further spreads of the disease.
O ko mahu inga au pito, ke whakawhitu utaki ke tau pot ngai mo ui, ke tokoni ke no tata o whikono whakamafola o whakoutua.